the novel COVID-19 exposed our world and its inhabitants, and Ghana was no exception. For the first time, Ghana was quieter than the cemetery when the government made the decision to go on lockdown. And this is one of the greatest mysteries we've ever faced as a people and a country. The spark of a global emergency has caused Ghana to go to sleep. We will never know the purpose of the storm until we see the results it produces. The declaration of COVID-19 as a global pandemic in March 2020 compelled national and city governments worldwide to implement a raft of health and safety protocols. This included directives such as working from home, practicing regular hand washing, and avoiding poorly ventilated spaces. Adherence to these depended heavily on having access to decent housing that provides basic services. We present the findings from collaborative research, which explored how household compositions and housing characteristics impacted households' adherence or otherwise to COVID-19 health and safety protocols.
COVID-19 like serious. Later on, so yes for by me. So yes, I was so yes for by the next year. And he breaks. As a MP. Shedem, but I don't want to go to me. COVID by you, so also came across all one sounds not a corn. Well, also came with as I told you anybody. I'm watching the myth make us a wife.
The government suspension of the payment of water tariffs by households further encouraged more regular hand washing by households.
During the COVID, we had a lot of water flowing through the taps, so we did not have any problem with water during the COVID. So we were always observing the protocols with enough water.
Where we are getting the water from is from the well, and you know well water is not much hygienic, so we only use it for ablution and washing of our clothes, and also even drinking, we can't drink it.
Housing deficiencies such as poor ventilation, sharing of toilets and bathroom facilities in some dwellings, and the complete absence of toilets and bathroom facilities in other dwellings compelled some households to resort to public sanitary facilities, which increased their risk of contracting the virus.
You know, here we don't normally have a bathhouse or a washroom, so moving from here to where the toilet is, it can take you about 15 minutes. Or where they are bathing, it can take you about 15 minutes. So imagine you walking from here to there. Even it's not easy.
Public toilet, and I yoko. Sabi if you need toilet, a man saying na toilet in any yakoso. Toko awuko jinaho.
To improve housing conditions and promote greater adherence to health and safety protocols in future pandemics, we offer the following 5 recommendations. 1. The extension of an electricity tariff payment freeze to water vendors who supply water to areas lacking water from the public mains. 2. A review of some provisions in Ghana's building regulations to ensure good housing design. 3. Supporting the provision of housing with basic facilities. 4. Promoting holistic urban planning and house building. And 5. Promoting adaptive design of buildings in a post-pandemic world. It is also evident that the COVID-19 pandemic has provided an impetus and key learning opportunities for government, local planning authorities, and professionals in the building industry to take bold steps towards improving housing delivery and housing circumstances of households to ensure that current and future housing delivery is fit for a pandemic-prone world.